Hello. So today I'm going to talk to you about menopause. I'm sure that you all have a lot of cases of menopause and you must be managing them well with homeopathy and the other alternative methods. So today I'm going to talk to you about my approach in managing the cases of menopause. So basically, I talk to my patients who come to me and I do a lot of counseling regarding nutrition as well as exercise, etc., to let them know the benefits of how homeopathy and yoga can work together towards solving these problems. So, what I'm going to share today is my approach to a typical case of menopause. So, first of all, menopause is a physiological process which goes on in a woman's life. And there are a lot of changes that happen in a woman's life at this particular stage. So, there are changes at a physical level, at a physiological level, as well as at the psychological level of the patient. Okay, so menopause is a process in which essentially the female organs or the ovaries stop producing estrogen and progesterone, and hence there is no ovulation and hence there is no menstruation. So the menopause can occur at any age, at around after around 50, but we are seeing now that it is occurring at an earlier age. So essentially, that is one challenging thing that we have to explain to the patient as well, because a lot of women are coming with menopausal symptoms as early as the age of 35 to 40 years, and it takes around 5 years for her to go through the entire process and settle down. So we really have to manage these cases well, otherwise they can create a lot of problems for it can create a lot of problems for them at a social level as well. So there are the symptoms in short term and long term which we need to manage. So in short term, we see that all of these women who come may complain of hot flashes that they get, or vaginal dryness, or reduced sexual drive, and there are these kind of symptoms which they can often come with. And so so as I said, that it takes around 1 to 5 years for the entire process to settle. So this is what we need to manage for that entire period of time. And essentially, we need to understand that it is because of lack of estrogen that these women are having these kind of problems. So, and in the long term, we see that they can have osteoporosis or increased risk for cardiovascular problems, etc. So there is this dilemma always that each doctor has a different approach towards menopause. So a lot of your patients are going to ask you about this, whether she should take hormonal replacement therapy, whether she should not take, whether alternative methods are more useful, and so on and so forth. So basically, this is the dilemma that our medical doctors are in at the moment as well, because they know that not one kind of approach helps them, especially the HRT, which they advocate in the Western medical system, and they don't consider that menopause is actually a physiological problem that a woman goes through. So often they will not understand all the other aspects related to it, and they will give them some hormones. Essentially, it's going to be hormone replacement therapy according to allopathy. Whereas when we consider homeopathy, our approach is more holistic. We are trying to understand that this process of menopause is a very natural process that every woman is going to go through, and so we approach it in a very holistic manner. So, as I said, that hormone replacement therapy is many a times people are trying to understand the risks versus the benefits of hormone replacement therapy. So essentially, in HRT, what is done is low doses of estrogen are given, but when we see that in spite of giving the low doses of estrogen, some women can complain of interval bleeding or bleeding between the cycle, etc. So then progesterone is also added. But having done all this, they say that it gives a window of opportunity to the woman, because this estrogen and progesterone, etc., are known to prevent osteoporosis or prevent the risk of cardiovascular complications in women. But there are long-term side effects of these kind of hormones being given. Especially the major side effects are increased risk of uterine cancer as well as breast cancer. Now, this has been scientifically proven. So, it is very important that we make our patients aware of all the possible alternatives also. And when I do that, I talk to them about the natural alternatives, that is homeopathy, nutrition, exercise, and yoga. I believe that the combination of homeopathy, nutrition, and yoga is something which helps in the long run, because this is a sure short way of ensuring that all the natural processes are taken care of. So homeopathy uses, I talk to them about how homeopathic medicines are prepared and how they can help you with very less side effects, how certain foods can be included in your diet which can help you to have the natural phytoestrogens, and how homeopathy also considers the emotional symptoms as well, which is a huge advantage over all the other systems of treatment. So I would just like to share a case which I had recently, and this case was, of course, of a menopausal woman who was not very well educated, and she was accompanied by her daughter in law. So I was getting a lot of information from the daughter in law as well. And she had the usual symptoms of palpitations and hot flushes and confusion and so on and so forth. But what really stood out in her case was that the daughter-in-law gave information about the patient, that patient had started talking a lot since a few months, and that change was very prominent. So I considered few of the symptoms based on all the information that I got. They were, loquacity, especially during this menopausal age. Then I also considered the hot flushes. I also considered the forgetfulness that was specially mentioned by the daughter-in-law. So all these symptoms were pointing out towards obviously the remedy lachesis. But what changed my prescription was that one more symptom or one more observation which the daughter-in-law had really made about her mother-in-law, and that was that the patient had developed an habit of counting everything that was kept in the room. So she just kept on randomly counting things as to what has been kept where and how many things have been kept where and all that. That was a very important observation which I could not understand. So I went and looked into the repertory, where I found that there is a rubric in the mind section which says that counting everything in the room. Okay, so that rubric led me to physostigma, and if you've seen in my previous slide, the second remedy that was coming was physostigma. So then this particular symptom gave me the confidence of prescribing physostigma in this case. So I prescribed her few doses of physostigma, and on a monthly basis, I was giving her the SL and physostigma and advising her diet and all those things which I am going to share with you. And on that, she beautifully responded and she did very well, and she eased into menopause very well. So I talk to them a lot about yoga because I believe that yoga has the capacity in improving the circulation and your energy levels. Hence, when your circulation and energy levels improve, your uterine and ovarian functions also will improve. So the other thing I also talk to them about is nutrition, because I believe that it is very important that they take adequate amount of calcium and vitamin D3 and all the dairy products and green leafy vegetables, etc., which are a good source and which are a natural source of calcium, and they take adequate amount of protein. I talk to them about the healthy diet, because this can make a huge difference. Reduction of sugar, refined sugar, can make a huge difference to their mood changes. It's very important for the patients to understand this. It's very important for them to understand what are phytoestrogens and how naturally occurring phytoestrogens can help them, and how they can work similar to the artificial estrogens. So basically it is increasing the substances that are rich in phytoestrogens, like some of the legumes like chickpeas and flax seeds, and other seeds like sesame seeds, sunflower seeds, almonds, etc., which are rich in these phytoestrogens, and they are very natural, so there's no question of any side effects from this. Then I also talk about reducing the consumption of alcohol and caffeine and smoking. And in conclusion, I tell them that menopause is a time of physical and emotional change, but it is not something that you have to struggle with. It is not a disease as it has been engraved in your minds. So I tell them a lot about how it is just a simple physiological process through which you're going, and there are some emotional things associated with it. And seeing convince them to see this as an opportunity to evolve and grow and to help themselves in this smooth transition through menopause with the use of natural therapies like homeopathy, yoga, and nutrition. So this is my approach in almost all my cases which I do. I do a lot of cases with a lot of women disorders, starting from menarche to menopause and conception to delivery. So I've been handling a lot of these cases for more than 25 years, and I've been doing this as a specialty at Prana Homeopathy Yoga Center. So I hope you've enjoyed this case that I have shared with you, and looking forward to meet you soon. Thank you.